Hello. Hello, everyone. Good evening. It's evening time, and I'm hoping there will be minimum disturbance, although I cannot predict that. In fact, would be prudent to say that there will be some disturbance, unforeseen, and I'm just going to apologize in advance. Let's wait for the day I have my own studio. For now, where am I? I'm at clinicaltrials.gov, maintained by the NIH, US National Library of Medicine, and you can read what I'm reading, but I'll read it for you. ClinicalTrials.gov is a database of privately and publicly funded clinical studies conducted around the world. Explore 401,716 research studies in all 50 states and in 220 countries. So what I am going to demonstrate, which I believe millions would be familiar with already, but I'm just going to enter, well, isn't that good? Actually, it must have remembered that I typed this in the form. So COVID-19, and the other term is, what did I type? Ivermectin. And no country specified, just search. And the results would load. Here we have 83 studies. And you can filter by not yet recruiting, enrolling by invitation, etc., etc. So these are completed studies. And you can go into the details. You can look at which place the study was conducted in. So what should we look at? Should we look at one of these studies and what they intend to do? What should we look at? Let's look at this one, where it is completed and has results. This is actually a good one because the only drug used is ivermectin. There are no other drugs used. That's on number 2. If you look at other studies, like here's this one, number 6, ivermectin and nitazoxanide combination therapy, or there's one for prophylaxis of COVID-19. And you find so many studies on ivermectin for COVID-19. But let's look at this one, and I'll leave it to you to go through what the findings are. So it says it has results. All I need to do is click on the link, and it should load. Recruitment status, it is completed. First posted November 27, 2020. Results first posted January 27, 2021. Last update posted January 27, 2021. Study results, you can look here. What was the kind of study? What was the design? Allocation randomized, intervention model, parallel assignment, masking, none, open label, primary purpose treatment. Condition, COVID-19, intervention, drug, ivermectin. Enrollment, 66. And you can go through the details if you're the kind of person who wants to go through the details. And it is excellent. This is all transparent. So if one of my relatives who's a doctor would be going through this, his understanding would be definitely more nuanced, more accurate, and he could put it in context, or she could put it in context with their existing knowledge. I also do research, but I never pursued this as a profession. But I'm familiar with how these things work. So when I need to, I do research on, rarely on clinical trials. I don't come here often, very rarely. But I do my research on FDA recalls. So many medical products and medicines are recalled, and the FDA is totally transparent about that. Or I could go to the CDC website. I could look there. So, but this is just for the purpose of demonstration. It's going on 6 minutes, and I actually do not intend to make this any longer. But I've already demonstrated to you what I wanted to show you. If you feel you are not competent to understand the results, then by all means, share the link over an email or a message with someone who can understand these results, and encourage them also to, if they are in a capacity to conduct trials, then to have the data recorded for the benefit of everyone. When you do a trial, you don't do it with the purpose of, or with the foreknowledge that you would succeed. Trials are for the basis of finding out results, and there's full disclosure to the patients, ideally, that that is what we call informed consent, so they know they will be part of a study. There are conditions, of course. I'm not saying it's all with full knowledge all the time, because that would defeat the purpose of the study as well in many cases. But when you get these results from what is recorded, the doctor or the doctors conducting the study, or the hospitals where these studies are conducted, they are responsible. They're noted down. Every time under locations, you'll see the name of the hospital. You'll see the state or the country or the city. And you keep going down in the results. And when this is posted, a person in Iraq could look at what's in Israel. A person in the United States, Pennsylvania, United States, study number 12 was withdrawn. They can look at what was happening in Egypt, study number 14. So it's all collaborated on internationally, it's transparent, and this is excellent. This could not have been done without the possibility of the internet. So this is something I wanted to demonstrate. Not that I use it very often, but in case I need to, it's available to anyone. Basic knowledge of the internet, and you can go through the results. That's what I wanted to share with you. I've already gone longer than I intended. That is all. Thank you very much for your attention and your time. I hope this benefits you.